I am Sergio Giralt, Professor of Medicine at Weill Cornell Medical College and Chief of the Adult BMT Service at Memorial Sloan Kettering Cancer Center. Thank you for coming for this update on hematologic malignancy. Today we have an excellent program for you. Our educational objectives are to define the cytogenetic and biologic disease characteristics of hematologic malignancies that inform the appropriate selection of available treatment options and stem cell transplantation for high-risk patients. We will explain the NCCN and other expert guidelines for the management of MDS, AML, and ALL in high-risk patients with advanced age, comorbidity, relapse disease, and particular genetic mutations. We'll identify the current recommended conditioning regimens, toxicity, supportive care strategies, and associated outcomes for patients with hematologic malignancies. And we'll discuss the safety and efficacy of emerging conditioning agents for hematologic malignancies, including refractory relapse, MDS, AML, and ALL, and their potential for enhanced clinical outcomes. We have an excellent agenda today. We will begin with Dr. Bart Scott, an associate member of Fred Hutchinson Cancer Research Center and associate professor of medicine in the Division of Oncology at the University of Washington Medical Center. We will be followed by Dr. David Marks, professor of hematology and stem cell transplantation at the University of Bristol. And I will close out with clinical outcomes of new and emerging targeted conditioning regimens. These are my disclosures, and these are the disclosures of the other faculty members. This is the accreditation statement and the designation of credit statement. You will get 1 AMA CME credit. Our sponsors are the Medical College of Wisconsin for CME and Health Matters CME. The activity is jointly provided by these two organizations. This activity is supported by an educational grant from Actinium Pharmaceuticals. Before we begin, I must advise everybody that as part of my disclosure, I am a member of the Scientific Advisory Board of Actinium Pharmaceuticals, which are the company that's developing IOMAB, which we will talk at the end.